Did you know? VA provides top quality healthcare tailored to unique needs of each veteran. Through your honorable service to our nation, you may be eligible for many healthcare services and benefits. Explore these and other benefits and services available through VA healthcare. How VA benefits works. Eligibility. If you served in the active military, naval, or air service and were separated under any condition other than dishonorable, you may qualify for VA health care benefits. Current and former member of Reserve or National Guard who called it active duty other than for training only by a federal order completed full period for which they were called it or ordered to active duty may also be eligible for VA health care minimum duty requirement. Most veterans who enlisted after September 7, 1980 or entered active duty after October 16, 1981 must serve 24 continuous months or full period for which they were called to active duty to be eligible. This minimum duty requirement may not apply to veterans who were discharged for disability incurred or aggravated in the line of duty, were discharged for hardship, or received an early out. Since there are many other exceptions to the minimum duty requirement, VA encourage all veterans to apply to determine their enrollment eligibility. Benefits of enrolling. VA offers a variety of healthcare services from basic primary care to nursing home care for eligible veterans. Enrolled veterans are assured that service will be available regardless of where they seek their care or how often without having to repeat the application process. VA is America's largest integrated healthcare system, serving more than 6 million veterans each year. Reason to enroll. VA healthcare meets the minimum essential coverage requirements under the Affordable Care Act. Medical care rated among the best in the U.S. No open season or waiting period for healthcare coverage. Veterans can apply for VA healthcare enrollment at any time. Reason to enroll. No enrollment fee, monthly premiums, or deductible. Many veterans have no out of pocket costs. Some veterans may have to pay small copayment for healthcare or prescription drugs. More than 1,700 VA medical facilities are available. Enrolled veterans are traveling or spending time away from their preferred facility can obtain care at any VA healthcare facility across the country without having to reapply. Freedom to use other plans your VA care, including Medicare, Medicaid, TRICARE, or private insurance. VA offers a comprehensive medical benefit package that is generally available to all enrolled veterans. Enrolling in VA healthcare. Quickly find out if you may be eligible for enrollment. Use the online VA Health Benefits Explorer at www.va.gov /health benefits /app explorer to answer a few questions about yourself. You will be asked it no more than 15 questions and learn about the VA health care benefits you could receive as an enrolled veteran. Afterwards, you will be given an opportunity to apply for enrollment. If you wish, you can skip the explorer and simply apply for enrollment using one of the following options below. The easy way to apply for enrollment is by phone. Veteran complete application for enrollment in VA healthcare by telephone. To apply, call 1-877-222-VETS 8387 Monday through Friday between 8 a.m. to 8 p.m. Eastern Time. VA staff member will collect the needed information and process the application for enrollment determination. Enrolling in VA healthcare online. Veterans can fill out the application online at www.va.gov /healthcare /apply /application /introduction and electronically submit it to VA for processing. VA will search for your supporting documentation through the electronics information system and contact you if unavailable to verify your military service. By mail, the application form can be downloaded from www.va.gov /healthcare how to apply. Mail the completed and signed form to Health Eligibility Center, Enrollment Eligibility Division, 2957 Claremont Road, Northeast, Suite 200, Atlanta, Georgia. Zip code is 30329-1647. Enrollment priority groups. What are they and how do they work? VA administers is a medical benefit through a patient enrollment system. The enrollment system is based on priority groups, PGS, to ensure healthcare benefits are really available to all enrolled veterans. Example, priority group 1 won't pay copays for any type of care, test, or medication. The higher the priority group number is, the higher the out-of-pocket cost that the veteran pays. VA and other health plans. If you have health care coverage through other health plans, such as a private insurance plan, Medicare, Medicaid, or TRICARE, you can continue using VA along with these health plans. Remember, it's always a good idea to form your VA health care provider if you are receiving care outside of the VA so your health care can be coordinated. Private health insurance. In situations where veterans have VA health care and other health plans, community health care providers may not bill any other health plan for a non emergent care authorized by VA. If you have both VA and another health plan and receive emergency care at a community facility for the treatment of surface connected condition, you may choose to use VA or the other health plan, but not both. There are a limitation of VA's ability to provide coverage when you have other health insurance, OHI. If you have other OHI, but the OHI does not fully cover the cost of a treatment, VA may pay certain costs for which you are personally liable unless payment by your OHI was barred because you or your provider failed to comply with the provision of your health plan contract or third party payer. For example, failure to submit a bill or medical records within a specific time limits, or failure to exhaust appeals of denial of the payment. VA is required to build other health plans for medical care, supplies, and prescriptions provided for treatment of veterans' non-service connected conditions. All veterans applying for VA health care are required to provide information on their health plan coverage, including coverage provided under the health plan's policy of their spouses, if applicable. The VA health care benefit is not considered a health insurance plan. Enrolled veterans can provide or update their information by using the VA Form 10-10 EZR Health Benefits Update Form at www.va.gov healthcare /update health information, or calling 1 877 222 VETS or 8387 Monday through Friday between 8 a.m. to 8 p.m. Eastern Time, presenting their health insurance card to the clerk during check in. Medicare coverage, credible coverage. Enrollment in a VA healthcare system is considered credible coverage for Medicare Part D purposes. This means VA prescription drug coverage is at least as good as the Medicare Part D coverage. Since only veterans can enroll in a VA healthcare system, dependents and family members do not receive credible coverage under veteran enrollment. VA does not recommend veteran cancel or decline coverage in Medicare or other health care plans solely because they are enrolled in a VA health care. VA does not normally provide care for veteran dependents and family members. In addition, veterans who elect to cancel their Medicare Part B coverage will not be able to obtain coverage until January of the following year. There is no guarantee in the future years Congress will appropriate sufficient medical care funds for VA to provide care for all the enrollment priority groups. This could leave veterans, especially those enrolled in one of the lower priority groups, with no access to VA healthcare coverage. For this reason, having a secondary source of coverage may be in the veteran's best interest. For more information, to go to www.va.gov /healthcare about VA health benefits /VA healthcare and other insurance. Enrolling in both VA and Medicare can provide veteran flexibility. Selecting a Medicare Part A coverage comes at a no added cost, whereas Part B comes with a monthly premium. Some veterans may choose to delay enrollment in Part B if they already have other mainly employer coverage. However, if a veteran delays Part B enrollment initially but decides to enroll at a later date, then they would have to pay a penalty. In other words, VA health coverage does not protect against having to pay a penalty for Part B like it does for Part D. Having VA health does not qualify as other coverage for Part B. Veterans should bring their Medicare cards to the next VA appointment to update their private health insurance information. Medicare Part C known as Medicare Advantage. Medicare Part C refers to Medicare Advantage plans which are offered by private companies that contract with Medicare. A Medicare Advantage plan provides all of your Part A and Part B services and usually vision, dental, hearing, and Part D pharmacy coverage. You may pay a plan premium each month in addition to your Medicare Part B premium. You must get all your healthcare service from Medicare Advantage plans, networks, or providers. This does not apply to emergency services. Medicare Part C and VA. Medicare Advantage MA plan doesn't replace your Veteran Affairs VA coverage, it complements it. With a Medicare Advantage plan, you can use healthcare providers and hospitals outside the VA system, which may be closer to home, especially in an emergency. VA out of pocket costs. Urgent care. Veterans may be charged a copayment for urgent care that's different from other VA medical copayments. Copay depends on the veteran's assignment priority group and the number of times the urgent care providers visit in a calendar year. Copayment charges are billed separately by VA as part of the VA billing process. There is no limit to the number of times a veteran can go to the urgent care provider. VA copayment. Outpatient care is defined as the primary or specialty care that does not require an overnight stay. Copayments for outpatient care are listed in the table. Note, veterans who have a service connected rating of 10% or higher are not required to pay a copayment for outpatient medical care. VA copayment inpatient care occurs when a patient condition requires admission to the hospital. There are two inpatient copayment rates: is a full rate and a reduced rate. Veterans living in high cost area may qualify for a reduced inpatient copay rate. Applying for Medicare or have VA benefits? Let's talk. Together, we can help you find a plan that will meet your needs or to learn more how VA benefits work with Medicare. For a free consultation, go to www.comraderyhealthagency.com or call 224-433-5754. Like us on Facebook, connect with us on LinkedIn, and subscribe to our YouTube channel.